Well, good morning, everyone. We have the Chief Health Officer with us today for what is a fantastic COVID update for Queensland. Real cause for celebration. It's now 28 days since the last new case of that southwest Brisbane cluster. A fantastic result for Queensland. Very, very well done. I can also report that we've had no further cases of COVID-19 overnight. We now have just 4 active cases all up. And in the last testing period, Queenslanders met our target. In fact, we did 5,555 tests, whichever way you look at it, is a great number. We can also confirm that police have identified 3 further show support workers who travelled to Queensland inappropriately and have now been asked to leave. They're on our way returning. We continue to very closely monitor the case numbers in New South Wales and Victoria. We are particularly closely monitoring the effort in New South Wales to manage that new cluster that they are experiencing in southwestern Sydney. You'll have noted that in recent days, New South Wales is reporting similar numbers to Victoria. In fact, yesterday, New South Wales had more cases than Victoria. All of these figures, all of that data comes from a national report from the federal government's National Incident Room. So I just want to emphasise that this isn't data that Queensland is creating, it's data provided by states to the Commonwealth and then distributed to all of the states. Also really pleased to see that New Zealand has confirmed today that they have eliminated their community transmission, which is very, very good news. And so they, of course, now join Queensland, WA, the Northern Territory, South Australia, Tasmania and the ACT, all having no community transmission. And I think it just underlines how disappointing it is to see the New South Wales Premier admit that they don't share that aspiration, they don't aspire to that target, that they've effectively given up on that goal of 28 days of no unlinked transmission. We are also continuing to get positive wastewater test results from Cannon Vale, and that's concerning. The Chief Health Officer will talk more about that, but we would like to see more people getting tested in and around Airlie Beach and Mackay. That's really very, very important. The World Bank issued a statement today endorsing Australia's swift response to the coronavirus outbreak, our swift application of restrictions, and urging Australia not to lift restrictions too quickly in pursuit of economic growth, urging us to retain restrictions for so long as they are required to suppress community transmission. And I think that's underlined by new data out of the United States overnight, showing that the US government will run a deficit of $3.1 trillion. That is 4.3 trillion Australian dollars, a massive deficit, and just underlines the economic impact of not prioritising healthcare first and foremost. In France, they've seen a new high of case numbers, and the number of people in hospital in France is now back at a 3-month high as that second wave escalates higher than the first. Brazil just passed 5 million cases. 5 million cases. Now, as I've outlined in the past, my intention with these COVID updates through the caretaker period, through the election campaign, is that we will provide a COVID update, coronavirus update. I'll speak, the Chief Health Officer will speak, the Chief Health Officer will take questions, then we'll allow her to get back to her important work while we hold any political questions and questions related to the election campaign. I'm happy to address those once Jeanette has left. Thank you.
Thank you very much, Deputy Premier. So very good news here in Queensland, no new cases overnight, and as you've heard, it's 28 days now that we've not had cases, so that I can declare that last cluster totally over. So that is a really good thing. We did have one case that I received a positive result on yesterday. That's one of the crew members on that ship sited off Weipa. If you remember, we had 2 positive cases in crew members who were transferred to Cairns Hospital over a week ago. So we were doing the routine day 10 testing for all the crew, and one of those tests came back positive. We've retested that person and it's negative. So at this stage we're just working out whether he might be a persistent shedder that's previously had the infection and recovered but persistently shedding, so we'll get some more tests done, or whether indeed it's a false positive. He's perfectly well and he's isolating in his cabin at the moment, and we'll work out whether we need to evacuate him from that ship or not. And we will of course continue to test all of the remaining crew on that vessel. So this is excellent outcome for Queensland. Now there's also been a good outcome from New South Wales. So they've found links for 7 of the 8 cases that they notified yesterday. And I understand they have a further 10 cases today, 5 of them in hotel quarantine, which of course aren't any risk at all, and then 5 in the community, but all 5 of them, they know how they've acquired those cases. So New South Wales has extremely good contact tracing capability, and they're using that at the moment. And so we just need to wait a bit longer before we decide whether or not there's been any need to change that planned opening to New South Wales, that at this point in time is planned for the 1st of November. As you would know, we use that 28 days of no unlinked community cases to assist us in determining whether it's safe at that point in time at the end of the month to open to another state. And that has stood us very, very well in Queensland. So we'll continue to monitor what's happening in New South Wales. They do have a concern which they're well aware of and well on top of at the Liverpool Hospital and also at a private clinic. So those 5 cases today that they've announced, I understand, are all related to healthcare facilities. And that's why, although it's very, very difficult, and it's a very difficult decision each time it's made, but we do ask people who have been to healthcare facilities in either Sydney or in Melbourne that they do need to quarantine when they come back to Queensland, because we know there have been a lot of cases that have occurred out of healthcare facilities. Indeed, here in Queensland we saw that small cluster at the Ipswich Hospital that the Ipswich Hospital managed so well and got on top of very quickly. But it can be hard getting on top of those clusters in healthcare facilities for a whole range of reasons which are quite understandable. So that's where we're going at the moment in terms of assessing what's going on in New South Wales. We of course are also monitoring very, very carefully what's going on in Victoria. They continue to have those very strict systems in place in terms of managing movement in their community, and as a result they've been able to control those case numbers, and that's been really good to see. Happy to take any questions. At the end of each month is when we assess what's been going on in the previous 28 days, and so we'll make that assessment then, because there are a whole range of issues. Most issues New South Wales are very well on top of. They're very good. So we also want to see significant testing. I mean, there's no point just having a bland 28 days of no community-acquired unlinked cases if you don't have testing in place. So we do like to see the amount of testing. Then they've also got sewerage testing, which has proved to be a very useful strategy. And indeed, that picked up some of their more recent cases before they picked them up in people. They picked it up in sewerage first, and it led them to where to go to test. So that's a very important issue. So there are quite a number of factors that we take into consideration and look at, and those will be taken into consideration at the end of the month. Maybe if I could, I forgot to mention our sewage testing here in Queensland, which also I think is very, very important for us. We're not quite sure yet what it means, but we know it's a trigger that we need to do more testing, as we've just seen in New South Wales. So we have had quite a few positive tests in Cannon Vale now and Airlie Beach. So it is really important that anyone who lives in that area of Mackay and has any symptoms at all, that they come forward and get tested, because we are seeing persistent virus in the sewerage there. The rest of the state, although we've had positives, I'm quite comfortable that I can relate that positive test in the sewerage to cases that I'm aware of in the community or in hotel quarantine.
Just in regards to that 48 hours window that New South Wales is given to get on top of this, do you have like an actual hour or an actual day when they've got a firm deadline of what they have to?
No. So it's 48 hours from when the case interview occurs. That's the time frame. So I discussed this with the Chief Health Officer in New South Wales yesterday and was given all of the information about the 7 contacts that they had found links to. So there's only one that they haven't. And then today the 5, I understand, they have links to all 5. They were linked to healthcare. So it's really finding out from New South Wales. And indeed, they've now found the link for that case that they had a while back, that they couldn't find the link at that time. So it's around 2 to 3 days from when that notification occurs. So there's a bit of time to go.
So does that mean there's only the one case now that they haven't got the link?
Yes, that's correct.
So how long do they have?
As I said, it's 48 hours.
Most political talk yesterday about it was decided on 48 hours, national decision,
Yeah.
48 hours, 48 hours, 48
Yep.
hours. Now you said 2 to 3 days.
No. The national decision was you've got to start the 48 hours at some point. Do you start the 48 hours when the person had their swab taken? Do you start it when the pathology lab gets the result? Do you start it, etc., etc.? So a decision was made nationally that the 48 hours would start from when the case interview has occurred. And that makes sense, because that's when you've got the information from the patient as to where they've been and where they might have contracted it.
A lot of people definitely. Are you feeling more confident now, given that they've been able to trace all of these cases in New South Wales, that will go ahead and
I am feeling more confident, but I've got to wait till the end of the month. There's actually quite a bit of time between now and the end of the month to see what's happening, because they are, although they're finding the contacts, because they are very, very good at contact tracing in New South Wales, they always have been right from the start, and it's stood them really well. They are getting continuing cases, so we will just have to watch and see what happens.
Dr. Young, Gary Brown, the brain surgery patient, have any concessions been made there? Is he going to be allowed to go home and recover there, or is he still being told he has to stay in hospital?
Yeah, so I asked one of the senior doctors at the PA hospital to go and assess him last night. That occurred, and based on that advice, this morning I've said that he can quarantine at home. There are a few conditions on that. I've asked for an urgent COVID test to be done on him and his partner this morning. We're waiting on those results. If those are negative, then we've organised ambulance to assist him. He's got some medical appointments first that need to occur.
Has a precedent been set here now? What happens when someone else might have surgery in Sydney and wants the same thing?
Yeah. No, this has happened, it hasn't happened often, but it has happened a number of times over the last few months, from when we brought in quarantine, so over the last 6 months, that when people clearly can't manage in hotel quarantine, but they don't need hospital care, and that was the decision I wanted sorted out last night, to make sure that we weren't discharging him from our care, because in the hotel he was in our care, and I didn't want to discharge him from our care into a situation that was unsafe for him.
Why last night was that decision? I mean, they've been making laws about this for a while, they've requested exemptions, etc. Why last night was this decision made to...
Because he actually went and had a medical appointment, and I got information from there.
That had been done earlier?
Yes. Well, it was done, so I found that out yesterday and asked for the review, and it happened. Sorry, I can't hear.
COVID safe schools plan.
Right.
When will that be updated to be in line with other restrictions being eased?
What aspect, sorry, of the plan? It's quite an extensive
Just
plan.
At the moment, they're going to find out that
From August.
from August.
We're only October. If things actually, we've been very, very fortunate in Queensland. We've not had a lot of cases. So we had those large cases in our first very small wave. Things since then have been fairly stable. So unless there's some concern with some part of the plan, which hasn't come to me, we wouldn't be updating them routinely.
Can I just ask about the 28 days? So is that a government decision or is that a decision of the AHPPC? So there was some criticism yesterday from the Health Minister in New South Wales describing it as the government as petty, but is it actually like your decision through the AHPPC or the Premier?
That is a health decision that was discussed at AHPPC.
So when would that have been made, like the 28-day decision about the...
That's right from day one. So people might remember I've been using that 28 days very early on because that's the traditional, and we discussed it earlier at the start of this press conference. That's when an outbreak is over, 2 incubation periods. So early on it was decided that 1 incubation period for this virus was 14 days, and that's remained throughout this. There's been some discussion about changing that incubation period, but at each time it's been decided that it remains the appropriate time frame. And then you declare an outbreak over, or you declare risk no longer being there after 2 incubation periods, because then that allows if you've missed for 1 chain of transmission. So it's a pretty standard thing. But then we had the discussion at AHPPC to just tighten it up in terms of that discussion I had earlier with you about when does the time frame extend, for how long before you can find out whether something is actually related, connected, linked.
Dr. Young, you said a 48-hour time period starts from the interview of the mystery case. When was that mystery case interviewed? What's actually 48, is there a time?
You need to ask New South Wales that question.
Are you aware of the answer?
No. I've been told when they announce their cases and that they've started contacting them. Now, which person they contact first, whether it was which of those 8 it was, I don't know.
Are you alarmed by the lack of communication between governments?
No. No, we're having fantastic communication. I'm getting all the information I need to be able to make those decisions. Yes.
When do you expect to be updated on that 48 hour window, that case, that mystery case?
We next meet on Monday, so I'm sure I'll get more information next Monday.
So in March you released modelling that suggested that we could have 12,500 deaths in the first 6 months. It's now 7 months, I think. How do you feel now, and do you have any updated modelling going forward?
Well, I feel extremely relieved. I mean, that terrified me. We got up to 86 cases in one day back in March. That was frightening. We were doubling our case numbers every 4 days. We were no different to what was happening in New York, in Italy, in London, and we looked like that's what we'd be facing here. Now, I have a lot of confidence in our health system. I have a lot of confidence in the work that we did to procure additional ventilators, to train additional staff, to go and do all of that work, to put in place all those plans. But I am so grateful, so thankful, so relieved that we didn't have to do it. Now, our job is to maintain where we are. We're in a really good position. And we heard from the Federal Treasurer that he doesn't expect any international travel until towards the end of next year. So I believe we can maintain the position where we are, that we can maintain suppression of this virus. We have got really good systems in place. We have got good contact tracers. They showed what they can achieve with that most recent outbreak, which was probably occurred in some of the worst settings, the worst nightmare settings for me, and they managed it absolutely brilliantly. So I am confident that when we get our next case here in the community in Queensland, and it will happen, this is a virus, we cannot stop it coming into Queensland. All we can do is manage it when it comes in. I'm also confident that Queenslanders are doing a brilliant job. You heard earlier that more than 5,000 tests were done in the last 24 hours, and that's in an environment where we genuinely don't think we've got the virus circulating. So we had people coming forward, putting themselves forward. It's not the most pleasant of tests, and then isolating till they get the result. And as long as Queenslanders keep doing that, I'm confident that we're not going to see that wave with 12,500 deaths.
Everyone done with the Chief? Thank you, Jeanette.
Thank
I'll
you.
see you shortly.
Minister Gary Ralph, just as spoken about earlier, did the Prime Minister intervene in any way here? Did he join in?
Look, I'm not aware of any intervention, but what you've just heard from the Chief Health Officer is her outlining the process that we go through here. When people return, they go into hotel quarantine, there is medical assessments done, and on the basis of that advice, she makes decisions. I think this has been actually a pretty swift process when you consider, I understand he only returned to the state a couple of days ago.
So you get a call from the Prime Minister, or did you get a call from Wayne Swan?
I haven't.
They've all been pretty heartbroken and annoyed about this particular case. Did anyone influence the decision at all, other than the Chief Health Officer?
No, I certainly haven't had a call from the Prime Minister, but what you can be very confident of is throughout we have not been intimidated by the Prime Minister or the other bullies in the Federal Coalition. We've taken the health advice, and that's precisely what we've done here, and I'm really pleased with this outcome.
You make a Brad Hazzard's comments this morning saying, as proof, this is all political from your end. Will you present that evidence, to be fair, but will you make his comments miscriticism?
Look, I don't know what Brad's talking about there. We talk often, as you might expect. I know that Brad is very eager to come to Queensland. I know he's desperate to get to Noosa. In fact, I've promised to buy him dinner in Noosa when he is allowed to come back here. But I wouldn't take much notice of one politician calling another politician political. What I would point out, though, and Brad, and this is quite different in Queensland to New South Wales. The Public Health Act in New South Wales provides most of the powers that our Chief Health Officer has to the Health Minister. So in New South Wales, these decisions literally are political. They are literally made by a politician, whereas here in Queensland, we have a system that puts our Chief Health Officer in charge of those decisions. I think that's a much better system. I can also say that Queensland will not be lectured to by New South Wales. Like, this is the state that gave us the Ruby Princess, the state that had those aged care outbreaks. We have avoided those situations here in Queensland precisely because we have aimed to suppress every outbreak of community transmission. That's what we've done, and we've done successfully. And as I say, I was pretty disappointed to hear the Premier of New South Wales say that she doesn't even aspire to do that. Can I just go back to Janelle's point about the modelling, because I think it's really important. We were projecting in October a 3-month peak of the first wave in which 12,500 people would die. 12,500 Queenslanders who are alive today because of the actions that we have all taken together. They are loved ones, family members, grandmas, granddads who are with us today. Instead, we've only experienced 6 deaths. Of course, they are all very tragic, but 6 compared to 12,500, that's the choice that we collectively as Queenslanders made to save those lives. And while we weren't sure of it at that time, we now know for certain that actually that health response delivered us a better economic outcome as well. It's allowed us to keep people in work, allowed us to keep key industries like resources and agriculture opening and functioning and delivering revenue to our state. Look, I outlined at various times in the lead up to caretaker and also more recently the exact process that we would go through with these daily briefings. That's exactly what we've done here this morning. I think it's appropriate. I continue to be the Health Minister of the state. We continue to be the government of the state. We'll continue to work with the Chief Health Officer throughout this period. I think that's what Queenslanders would expect from us. It is, and that's precisely why I asked you to hold political questions until after she had returned to her office. But I think it's also important that the people of Queensland see that our government is continuing to work with our health leadership to keep them safe. You know, this is the decision Queenslanders need to make over the next few weeks is who do they trust to keep them safe? And I think when it comes to that question, they will decide that it is our government, the Labor government, that's invested in healthcare and delivered with them, with Queenslanders, a very strong health response, which is the foundation of our economic response, getting people back to work.
Will government become distracted by the election and the campaign?
No, I don't think so. I think we continue to work very hard to keep Queenslanders safe. Of course, elections are important, and Queenslanders have an important decision to make over coming weeks, but we can and will continue to keep people safe throughout that period. Look, I want to underline just how quickly this election campaign is going. 550,000 Queenslanders have already registered for a postal vote. 17% of registered voters in Queensland have already registered for a postal vote. They'll start getting their postal votes next week. So there are just days before many, many Queenslanders decide who they trust to keep them safe. And so some people in the media and in the LNP might think that there's a long time, that there's weeks for Deb Frecklington to stop ducking and weaving and start answering those questions about how she will get to surplus, what services she will cut, but there is not weeks. We cannot wait till the 29th of October to find out how they will fund their promises, how they will get back to surplus. Voters will start voting next week, and they're entitled to know what Deb Frecklington's plans are to cut services to reach that unattainable surplus. Thank you all.
Can I just ask one last
Yeah, of course.
question? With the 48 hours, so it's fair enough to say that's up to the Chief Health Officer when that starts, like she'll find out from New South Wales Health.
That's right, it's up to the Chief Health Officer, in fact, in New South Wales to make that determination, and they'll advise the other Chief Health Officers via the AHPPC and the National Incident Room. We trust them to make those determinations and provide us with that advice. Thank you.